It is another interesting edition of your program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to find lasting solutions. I am your regular anchor, Shomowa Daniels. Our focus this week is between safe and unsafe abortions. We'll be right back after the news segment to talk about this controversial issue. Please don't go away, stay tuned.
Nigeria is currently facing complex and widespread crises characterized by multiple conflicts, which makes the ethical principles of humanitarian reporting more relevant than ever to influence policies and save more lives. The workshop focused majorly on deepening the understanding of journalists on international humanitarian laws, the dynamics of conflict, and deliberate balance in reporting.
When there are disasters or emergencies, we are there. And journalists are also the first set of people that will be at a disaster site. With this training, I am sure they are going to work hand in hand with us because they now will see themselves as part of agent of change in humanitarian activities.
Important for them to understand that in armed conflict there is a legal framework, and this legal framework is expected to be applied and respected by all people who are participating in an armed conflict. And as journalists, they can play a role in also propagating the messages of what the law says and also defending the law, and also when they're reporting on any situation of armed conflict, of using the right legal framework. So that it's not just, maybe mentioning the numbers or what is going on and how the battle is being played out, but also to look at the humanitarian side of the conflict. How are people who are living through that conflict, how are they affected?
Mass communication indicates that millions, if not billions, will listen to you and know exactly what you are saying. The biggest example of the negative use of media was what happened in Rwanda in 1994, when the radio was used to instigate genocide, one tribe against the other, and that caused the massacre of almost 1 million people. So the media can do a lot of damage, but it can do a lot of good as well. So journalists should be very careful.
This is a very important training that will go a long way to help us write better stories.
The International Committee of Red Cross, ICRC, and the Nigerian Red Cross Society support a wide range of interventions in Nigeria, including emergency medical care, primary health care, support for women and children, physical rehabilitation, and psychosocial support, especially for persons involved in attacks by armed conflicts and violence.
The Ikosi Isheri Axis Sensitization Program for Waste Managers, Food and Water Handlers is assisting its series to educate and equip residents in flood-affected areas of Lagos State on practical steps to prevent cholera outbreak.
Nigeria continues to experience recurrent cholera outbreaks, which is driven by climate change, widespread flooding, and limited access to clean water and sanitation. In Lagos State alone, the 2024 cholera epidemic recorded over 1,600 suspected cases, underscoring the urgent need for a stronger community-level awareness and preparedness.
We have to change our attitude towards our environment. We should desist from open defecation and open bathing or open urination.
We can prevent the spread of the disease, reduce the disease burden on the government, and give the average Lagosian a very healthy life.
Then we have the manual we have given them. We've also given them this container that they can use for their drinking water. And we also want them to be food soldiers wherever they are, in their communities, in their families, to also cascade this information down to the grassroots in this environment.
UNIDO and LASEPA, I give them kudos for bringing out this kind of initiative, the awareness to the Isheri community.
The training initiative is funded by the government of Japan as part of a collaboration under the United Nations Industrial Development Organization UNIDO project in partnership with the Lagos State government through LASEPA.
We believe that different organizations should work together towards the acceleration of the SDGs across the nonprofit ecosystem to the private sector and the government. We believe that every hand must be on deck if we are going to even try to achieve the SDGs by 2030. This initiative is about providing affordable finance for water credit. Today, based on research from UNICEF, there is a $9.2 billion gap in financing for water in Nigeria. This gap needs to be blocked, but using grants to block that gap is definitely impossible. Using just private capital to block that gap might be difficult. And that is the reason why we're seeing a collaboration for an innovative financing model. What this does is it provides more access to women to be able to take care of their children and their homes. They don't have to waste so much time using buckets to go and fetch water from streams. It also ensures better quality health care. Women and children do not need to die needless deaths because of lack of access to safe, clean water. It also ensures that the model is sustainable. It will not fizzle out because when it is grants, after the program ends, that is the end of the program. But because there is capital, private capital infused in this program, it ensures sustainability because it's a beautiful blend of profit with impact.
I mean, think about it. Water is life. Water is everything, right? Statistics tells us, depending on the literature you look at, that over 70% of Nigerians have access to water. However, just 23% have access to safe and potable water, right? So we've brought stakeholders together to have conversations, to also expose some of the financial instruments that we have to support this ecosystem.
It's not just Lagos, Nigeria as a whole. The statistics show that there's need for interventions of this nature, and that's why we're here. To have a holistic approach. We intend to get as many stakeholders on board as possible because we have experience. We've done this for over 30 years. We've been able to do this in other African countries, and we believe that replicating this in Nigeria wouldn't be a challenge because we have the support, we have the expertise, we have the long-term experience to be able to go all along, all the way to ensure that we're able to actually take this home. The whole idea is to remove the impediment between people in underserved communities and access to safe water and sanitation.
Every community should key into it. So if we can partner with this kind of program and have a one good drinkable water for the community, I think it's a good one for the local government to do. With the Lagos State government and other agencies that are involved, I believe by partnering with them, it's going to give us a good result at the end of the day.
Working across all fronts. Adio 2, which is, like I said, the new water treatment plant, will provide water for a lot of areas in Keja, Agege, Ojokoro, all the way down to Ogudu and even Lagos Island. That's the plan for the reticulation currently as it is installed. There could be a new reticulation line also built. Very early stages, we've only done a feasibility for that. We have not started construction of the new reticulation line.
As the 24th president of the Medical Women's Association of Nigeria Lagos State branch, I hereby hand over the insignia of office of M1 Lagos to Dr. Elaine Maria Okon, and she's hereby investitured as the 25th president of our association.
A woman in Nigeria is said to have 1 in 19 lifetime risk of dying during pregnancy, childbirth, or postpartum period due to common factors like eclampsia, gestational diabetes, hemorrhage, among others. For children under 5 years of age, malaria, pneumonia, and diarrhea account for over half of all deaths. Despite a slight drop in reported cases, the Medical Women Association of Nigeria Lagos State Chapter at this forum of the 24th Biennial Conference are asking for better outcomes.
Because we are women doctors, all right? So it's natural that we'll be interested in women and children. But then again, we believe that if we take care of women and children, we are taking care of the family, we are taking care of the community and the nation at large.
At this stage in our country, Nigeria, we should be up and doing. We should be at the top of our game, when we're talking about the health of women and children. Women shouldn't be dying because of they're doing what God created them to do.
We need to chart that roadmap. We need to chart it. And if M1 Lagos decides to front this fight, I pray the stakeholders, other stakeholders, would gladly join us.
Funding is extremely important because you cannot work. And then training of the medical practitioners as well as the community to participate in this program.
Special allowances to encourage health workers to practice in rural and underserved areas. The reason is that nobody wants to work where there is no power, where there is no pipe-borne water, where there is no internet, where there is no this and that. But
issues around improved enrollment for health insurance, dental health care, and cancer care also came to the fore.
The government cannot do it without your consent and your involvement. So while we're trying to create more awareness, we too try to encourage women to embrace. For instance, now we're talking about health insurance. We don't want out-of-pocket payments for health again. We want you to do the same thing you do for your car, for your house, pay upfront so that when the ill health that does not announce comes, you are not scared to go to the hospital.
We encourage everyone to brush twice daily, before breakfast and after dinner at night, to prevent any form of food accumulation that can lead to tooth decay.
The Medical Women Association of Nigeria is an apolitical and non-governmental organization dedicated to promoting women's health and increasing the influence of women in all aspects of medical profession. Driven by a passion that no Nigerian should die due to lack of timely help during road crashes and in other emergency situations like building collapse and flooding, Health Emergency Initiative, a non-governmental organization, started its intervention 10 years ago through payment of bills for accident victims, training of first responders across various states in Nigeria, and support for malnourished children in Lagos State.
Through its collaboration with public hospitals and communities, HEI has provided emergency assistance to over 50,000 individuals. Our collaboration bridges government and civil society, reinforcing the promise that emergency care is not a privilege but a right.
We come in as next of kin for accident victims, for victims of gas explosion. We are coming as next of kin for people exposed to building collapse. Working with key agencies, road safety, Lasambos, we have trained from LASMA to our friends here, the police, to fire service, secondary school students. We've exposed them to skills necessary to do something positive instead of taking pictures and videos during emergency.
Presenting an award of Outstanding Media Partner and Voice of Hope to African Independent Television, AIT, the Executive Director of Health Emergency Initiative, Pascal Chinini, said he would not have been able to go this far without their support.
The corporate space, only just a minority, commits CSR support to pinpoint-related issues of Nigerians. Most favor reality TV, entertainment, and other areas. Do it alone. That's why we throw it back to you, the media. We need to set the agenda for all of these things we said concerns everyone.
May every award here today inspire future further excellence and a greater commitment to the future where no Nigerian dies from a preventable cause.
Hope that more and more of us in the room today will put their hands on the saddle and join this group and do something that will please God Almighty in heaven.
With more than 133 million Nigerians living in multidimensional poverty Achinine said, too many lives are lost due to small but urgent hospital bills and lack of timely pre-hospital care during emergency situations in Nigeria.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
The controversial abortion bill seeking to impose a 10-year jail term for abortion-related offenses is generating reactions among Nigerians. The bill, introduced by Senator Bayemi Bamidele, is to reflect modern realities. But the absence of a clear definition of what is considered safe and unsafe abortions has raised concerns that even medically justified procedures could be punished, thereby worsening maternal health outcomes. This is our focus today on the program.
When we hear the word abortion, what comes to mind is, oh, this little girl, oh, this woman, she had a intercourse with some boy, with some random boy, you know. So, but abortion sometimes goes beyond having casual sex. What happens when a woman is raped and there is this, it has been scientifically proved that the zygote gets its hereditary gene both from the father and the mother, and in Igbo where I come from, I think it also cuts across several cultures. There is this saying, permit me to speak that in my language, then I'll translate. Meaning, if a child does not resemble the father, it definitely must resemble the mother. It can be facially, it can be character-wise, okay? And it also goes down the family circle. From that of the father, that's the paternal and the maternal. So those are the things that we have to also look at.
I'm very committed to the advocacy for safe abortion, for the whole country, not just the whole country, for everywhere, because there are people that are like, because abortion in Nigeria is, even though it is not, even though it is restricted, it is still like a privilege. And it's not supposed to be a privilege, it's supposed to be a right. It is a right, but it's not being implemented as a right.
Because of the society we find ourselves in, we find a lot of people seeking for these services, and because the services and the act itself is under a restricted kind of law. You cannot just come out and say that I'm pregnant and I don't want this child and I want to have an abortion. And at the end of the day, the repercussion for that is that you go out and start looking desperately for how you get it done. We've shared a lot of stories on what people do and the resultant effect of it. Some of these resultant effects is eventually death. And at times, we don't even emphasize the morbidity. Morbidity is as regards the health situation they have to live with for the rest of their life. Not talking about the psychological aspect, but even the health aspect, like imagine having to now rely on dialysis or looking out for kidney transplant and all that, just because the act of abortion was carried out, about a decision you just made. Or the fact that sepsis, we call that infection because of the environment where it was carried out. And at the end of the day, one or two organs have been compromised. And the one that people usually want to talk about is I had an abortion and I cannot get pregnant again. Even though it is not always that, but it also contributes in some ways to that, because if sepsis sets in, definitely the fallopian tubes may also be affected and may be a reason for a woman not getting pregnant. And I noted that it is not always the case, but when it happens, we may actually think that that is where it started from, because it was carried out in an unsafe environment. So there are myriads of complications that can set out, and the peak of it is a woman dying from that act. And that's the reason this conversation must be heard and must be made loud. It must be made loud. Every quarter should hear about it, and people should see to the reality, especially the stop guidelines that was held back, that we should look beyond the fact that it is not appropriate, it is not this, but the fact that people's life are going by the act of unsafe abortion.
Islamically, it is a taboo, it is forbidden, but in some cases it is allowed. Firstly, if it endangers the life of the mother, it is advised in Islam that the pregnancy be terminated. Secondly, in case of rape and incest, when the father impregnates his biological daughter, so it is advised also. Actually, there are various opinions from the scholars of Islam. Some agreed that if it is before 120 days, because pregnancy before 120 days is lifeless, that the pregnancy should be terminated. But some argued that even after 120 days, because of the psychological state of the mother, that the pregnancy be terminated and the father be punished according to Islamic rulings. And if by chance the lady give birth to the child will also inherit the father, but it is advisable because of the psychological strength of the mother that the child be terminated.
The foreign culture, we don't accept abortion, so abortion should be stopped. But abortion is an abomination before God. The word of God said, "Thou shalt not kill." So when you are committing abortion, that means you have killed a soul, and you don't know whether that person is going to be the president of this country or whatever. So my suggestion is that, idea is that, once you are pregnant, you give birth to it. All you ask God is, God, supply everything I need to take care of that child, whether married or unmarried. Even there are many people everywhere that are looking for children. They are spending money going to medical treatment everywhere. You don't need to kill any soul for any situation, whether you have money, you don't have money. If you know you are not ready for any child, go and do family planning. If you know you are not ready for any child as a young guy, keep yourself. You don't need to go and be having boyfriend. So if you know that you are not ready to give birth, keep your body, close your leg. That's all. God is against the law of God. God said we should not kill. Abortion is a sin. So we should not allow our children or ourselves to commit, or anybody to do it. So you don't know who is going to be a savior to their family. So you need to leave the person. There is nobody that is born by mistake. It's not born by mistake. God have a purpose of giving. There are many people today, they don't even have wombs. They are looking for adopt. Some people are looking for child everywhere, spending a hell of money. So it's a blessing. So no matter how it comes, we should accept it that it's a blessing, that we will be able to manage it, not to use it to commit sin. Because tomorrow God will ask us a question. For you to, is shedding of blood, removing an innocent blood that did not know anything. So for that reason, they should keep it.
Yes, I will draw the curtain to a close for this week on the program. Thanks for spending your time with us. Let's do it again same time next week. And please do endeavor to advertise your health products and services on the platform. I remain yours truly, Ushuamowa Daniels. Please keep staying safe.